Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. Bethaney Brenner. She is a dentist over in Burlington, actually just right off of Route 4. And you're going to start to notice, the more that you listen to this show, that there is a strong link between dentistry and sleeping disorders. I learned that myself during this show. You can find her online at theburlingtondentist.com. More importantly, you can give her a call and schedule a no-obligation consultation. As a matter of fact, if you're one of the first 5 callers by at the end of this show, you will receive a free sleep assessment. It's valued at approximately $250. I would even argue that it's probably worth even more. And if it's not you who needs it, maybe it's your spouse, maybe it's one of your children or both of your children. You'll get a free sleep assessment at the end of the show. Here's the number. Write this down right now because I want you to be able to dial fast more towards the end of the show. 860-673-7155. One more time, it's area code 860-673-7155. By the way, when you're on her website, feel free to click onto the link to YouTube, where she has her own YouTube channel. And in case you miss any of this show or any of the previous shows, you'll be able to watch and listen to them at your convenience. Well, good morning, Dr. Bethaney Brenner. Good to see you. How have you been?
Hot.
Yeah, well, I'll tell you, the last few weeks, I love the heat waves. I know we had one earlier this past week.
I don't mind it until I can't have air conditioning, and my air conditioning quit before the 4th of July. So.
Well, that's not fun.
No, it's not been fun. They're going to get it fixed. It's just I'm waiting in line.
Have you had a nice week?
Yeah, I have to wait till 3 o'clock in the morning when the temperature drops a little lower so I can get some cool air in my bedroom.
Do you have a fan?
Oh, I have fans running all the time.
I was going to say, at least it's blowing hot air.
But I have 3 fur babies, so, I've got to make sure they stay as cool as possible. So.
That's not healthy.
Well, they're struggling. They're drinking a lot of water. Poor things. Yeah. And it's too hot to go outside. It's hotter outside.
Well, but it's okay. And it's Saturday morning. It's not that bad today. Earlier in the week, oh my goodness, we had a few of those. I think we had like a heat wave. We had a few days of 90-degree temperatures. But if you think back a couple of weeks ago,
well, that's when it quit.
When the temperatures were 100 degrees, you got to get this fixed.
Yeah, well, I had the guy. I've used the same guy for 20 years. I know him really well. John's a great guy. He came out and he thought it had it fixed quick. Well, it only lasted about 10 minutes, and then it didn't work. So then he came back the next day and did the same thing, and then it's like, yep, it's dead. No. So, yeah,
Nothing
it
lasts,
is what it is.
Nothing lasts forever.
I have to get a new one. So.
And just think of how strong it'll be. When
we're actually increasing the size. So I'm like, okay.
You brought a guest in this morning. This is great. I can't wait for you to introduce him, and we'll find out more about him.
Yeah, so I brought in, and I'm going to call him a chiropractor, but he's a very special chiropractor.
So much more than that.
Yes, and it's Dr. Thomas Giammatteo.
Good morning.
Welcome, Doc.
Hi.
Nice to see you.
Nice to meet you both.
What does she mean when she says, well, you're a chiropractor, but you're so much more than that? That's very vague. Or what does that mean here?
One of my degrees is in chiropractic physician.
Mm-hmm.
I started off as a physical therapist, and I became a chiropractic physician. I have my PhD in neuroscience. I'm a naturopath, an acupuncturist, and a culinary chef. And between all those things, my wife and I developed a system of medicine called Integrative Manual Therapy. And we've been a licensed alternative medicine school by the state of Connecticut for the last 25 years. And we're moving into a nonprofit organization called Structural Medicine and Integrative Manual Therapy.
What does that all mean?
It's a quantum leap in science. It's a new form of medicine. It's actually a discipline into itself. We can actually take healthcare professionals and make them qualified in integrative manual therapy practitioners. So
how do you do that?
How do we do that? Well, we've been.
Or is that a complex question? Maybe.
It's a full medical school system program that we run.
Okay. Takes years. It's all based
a
on years.
4-year program.
Oh, it's okay. It is a 4-year program.
Yeah. Yep. So we start off in anatomy and physiology.
You would fall into that real nice.
Right. And we take healthcare professionals and have them just take a slight version into what they already know and really bring the structure to the front of their disease processes instead of the chasing it with medications. So we really look at how the posture is, how everything's changing.
I've got to ask you, Doc, how were you introduced to
Well, actually,
each other?
somebody else in Tom's
Yeah.
purview
One
found
of-
me.
One of my clients had
Right.
horrible TMJ, had been in multiple accidents. She wanted to see Dr. Beth, and I read Dr. Beth's report, and I said, I haven't met a dentist like this in 20 years.
Oh, I never met one ever.
That I truly respected, and I only know 4 in the whole world. And one's in Australia, one's in Germany, and one's in South America. And that really take and honor the problems of the mouth and don't just do cavities and resets. They look at it as a portal into the healthcare system.
And I call myself an oral physician. And it's, dentist has kind of been relegated to the mechanics side of dentistry. And although they teach us how to do that, it's like an orthopedic surgeon, right? He's doing the mechanics on the bones and the body, but they're still considered a physician. Well,
Sure.
So what's the difference here? So those of us who have taken, and I went through UConn's dental school. It's called the School of Dental Medicine for a reason. We're a DMD degree versus a DDS. And although there are more DDSs now that are having more medicine, we did 2 years of medical school. I had to follow all of the protocols for the medical students for the first 2 years. And then my class took the first part of the medical boards. So I took the medical boards and I took the dental boards. Interesting, right?
I'm not surprised though.
But
And haven't gotten to know you.
Getting all that anatomy, getting all that science for 2 years gave me a greater appreciation. And I can read medical journals and kind of, I know what they're talking about. So when Tom and I kind of connected, I have things I can't help people with. And then we've talked about forward head posture. We talked about back and neck pain. And so I was like, I'm not allowed to treat that. And I tell patients right up front, I can't help them with that. However, I know somebody who can. And so I refer them over to Tom.
You were trying to help me with my shoulder here.
Well, your shoulder, you can talk to him. He's the guy. So, but it's very interesting. The way we treat patients is different and yet very similar because we're going back to the whole body balance.
Mm-hmm. Everything is everything. So it doesn't, one person will come in with a jaw problem or a headache, another person will come in with a knee problem, but they all center on the same problem. One of them could be the alignment of the neck, and the other one could be a sprained ankle.
How much of this is neurological though?
75% is
Yeah.
part of the nervous system, and the nervous system reflects back. So when you get that balance, things can regrow again, and that's called neuroplasticity. We've actually grown nerves back in spinal cord injuries and traumatic brain injuries and cerebral palsy. Those are my specialties.
But before we start getting people's hopes up, I mean, not everything is guaranteed, right? I mean,
No,
there's a
no, it's not guaranteed, but we combine with your other healthcare professionals, we have greater improvement and success in resolving things. We never tell anybody just go one route.
Have you had a paraplegic come in and
So we have
and they walked out?
not in a day.
Right.
in
No,
two-
I don't mean that
but
literally
3
in one day.
years, Yes.
Wow.
So a nerve grows 1 millimeter a day. And there's 1,000 millimeters in a meter, which is a yard. So that takes 3.5 years to grow one, to down to the toes again. So we've had neuroregeneration. We help neuropathies. We help migraine headaches. We help people that have paresthesias secondary to surgeries. That the guy cut the nerve and we can regenerate that back.
How come I haven't heard of you? Or this?
When 1996, when I met my wife, who helped me create this, who passed away 10 years ago, we were called Regional Physical Therapy in the area of West Hartford and Bloomfield. And since then, in 2001, we started the Connecticut School of Integrative Manual Therapy, which the state of Connecticut said we are an occupation. And we can take somebody in from high school and healthcare professionals and make them healthcare professionals in 3 to 4 years. And they can practice. They are not licensed, but they can practice these methods. So we've been around for about 45 years doing this process. But it's really too long. It takes a lot of time, and people want the fast fix. But when people fly in from all over the world, I have people flying from Hong Kong, Taiwan, Canada.
Are you still
South
taking
America.
clients? Or
Yeah, we're always taking clients.
But you also travel to teach.
I travel to teach. I also teach postgraduate for the American Physical Therapy Association, American Massage Therapy Association, the Florida Chiropractic Association. So I'm on the leading edge of technology for all those professions.
Holy cow.
Plus published about 8 books, 2 PhDs. So this is the science of
So he's like me.
rehabilitation.
Yeah,
He's just the male version.
So you were reading my mind then.
Yeah. So and interestingly, we come to this from our own perspectives
Yeah.
to really hone in on helping people finding the root cause, right? So when I took a class with Tom one day, and so we were doing sacrum adjustments and learning about how that functions in the body, right?
The
And
lower hip and the back, yeah.
right. And so Tom says, well, it's going to improve your range of motion, how wide you can open. I'm like, no way. I was a big skeptic. And so he's like, all right, go around and check everybody. And then we'd all do these adjustments, and I'd check everybody's, and I kept seeing everybody increase that range of motion.
And
Now-
her jaw kept going lower and lower to the floor.
I'll bet.
And so I'm like, how is this working? So I'm a very curious person. I ask a lot of questions, and I was more probably disruptive than he wanted in his classes. But at the same time, this is not taught in anything that I've ever trained with. Anybody who's treating face, jaws, nothing. I hear nothing about this.
In listening to you, a milliliter a day, right?
Yes.
Okay, so
Yes.
millimeter a day.
Yes,
Millimeter a
millimeter a
day.
day.
I'm sorry, I may have said milliliter.
Yeah.
Millimeter a day. And so it varies. Specifically what your client would the issue that would be. Okay, so forget your name, forget you for a moment. How come I've never heard of this science, these experiments, that these cures, if you will?
We've been around for 50 years. We've been word of mouth. We've been in rehabilitation communities.
Listen, I respect the fact that you're word of mouth. Don't make no mistake about it. And that's maybe I'm asking the question wrong. I've never even heard that this can be done. And if I haven't heard it, I've got my thumb on the pulse of,
A lot of things.
lot of
especially in
things.
Connecticut.
No, we've been a quiet system. We've been developing.
You shouldn't be.
We've had other professionals think they can do what we can do, and they basically deter their patients from coming to us.
Why?
My wife was always blamed for giving people too much hope, and we've always succeeded on the success cases. But it's going back to this. This is quantum physics of the body medicines. We've taken the best of physical therapy. We've taken the best of osteopathic medicine. We've taken the best of chiropractic. Those all have been around for a number of years. We've taken the best of Chinese acupuncture and put it together in a layering system.
I've heard some things with acupuncture. Okay, so I didn't know. Is there a strong link between what
Yes.
you're doing in chiropractic and acupuncture?
Yes. Just imagine this as another route of all those holistic practices.
Okay.
But we bring the best of those together, and we have the leading gurus of all those helping us teach us and understand. So we throw out we keep the good things, and we throw out the bad things in that whole process, and we get down to ask the questions. Well, sorry that you caught COVID, or sorry that you got Lyme disease. I'm not worried about that. My worry is, why did your immune system shut down to allow you to get that disease? So we go back and we regenerate the immune system, and the disease is pushed back out again.
So when we talk about nasal breathing,
Right.
you hear me talk about immune systems.
All the time, yeah.
Right. So when I first went to Tom, one of the things that we talked about was where the thymus is. And a lot of people don't understand that's, here in the chest. And he goes, well, you can palpate that. I'm like, okay, I was never taught that in school. That never even came up. We knew where it was, and what the basic function of it was. But for the first time in my life, I'm palpating a thymus gland on somebody. So think
Which
about
traditional Western medicine thinks shrivels up and does nothing after the age of 7. It's just like they assume that the appendix doesn't do something in the body. Both of these organs were there. God put them there, so they're still functional.
Just like your tonsils, so you don't need them to live.
Right, but they're doing their system, and they get swollen when there's allergens or irritations, and they cut them out because they're irritating the person. You have to go back and say, well, what in the immune system is really pissed off, and then the tonsil just shrinks back to normal again. It's really healthy.
What areas can you not help in?
It's a system of medicine that goes and you approach me with any diagnostic disease that you've had in medicine. We help with the cardiovascular. We have a strong oncology support practice where
Definitely.
patients that are receiving oncology, they seem to go into remission faster. They stay longer. The radiation doesn't affect the whole body as much. But we can't say we cure cancer because even Western medicine can't do that. But we've helped assist those and reverse those. Things that are considered pathological and you're just going to go downhill in, we've helped reverse those. So I've had a gentleman who's 63 years old diagnosed with Parkinson's disease for the last 10 years. His father had it before him. He drove all the way from Pittsburgh, 9 hours to get to see me. He stayed for 3 days.
Sounds like people come to see you from all over. Yeah.
And he's had his 5th visit with me. His neurologist just fired him because he does not have Parkinson's anymore. He had a movement disorder, but it wasn't of the Parkinson's. It actually was because of a concussion and a brain injury that we just released. And now he's walking.
So how often do you come across people who've been misdiagnosed?
A lot.
That's my profession. I'm the heart of the hard. People don't walk in my door without having searched other people. So that's where I start with most people. So I teach physicians, and the physicians give me the hard cases to really analyze with a structural medicine process.
I'm telling you.
And you're right in West Hartford.
Yes.
We are. So we go
Yes.
from infertility, fertility to prenatal care, the birth, to helping the cerebral palsy kids reduce all their symptoms, even genetic disorders. We've changed potentials back from Down syndrome, Ehlers-Danlos syndrome.
Yeah, the
all
Ehlers
these
is.
things. So even this thing called SIBO, which is the new overgrowth of the system, is still poor posture, bad food, and you get the head up and out of their butt, and you have the head actually be able to see what the GI system is doing, then those things disappear. We are just like a simple plant, but we have to feed it right, we have to groom it right. And, the iPhone and the computers and the strain on our system all add up to those things.
Let me do this really fast. Folks, you're listening to The Sleep Show alongside Dr. Bethaney Brenner. I am Gary Byron. By the way, you can find her online at theburlingtondentist.com. And more importantly, 860-673-7155. Again, more towards the end of the show. We're about 10 minutes away from that, a little less. You want to be one of the first 5 callers to receive a free assessment, a free sleep assessment. Again, 860-673-7155. We have a guest with us this morning in our studio, Dr. Thomas Giammatteo, correct?
Perfect.
And folks, I'm right there with you, learning right along with you. And if you are having the same reactions that I'm having in the studio live right now, you're shaking your head going, this sounds unbelievable. More importantly, why, if this, you might even be thinking, well, how come I never heard anything of this? Come on. This can't be.
No, you have to be looking for this. You're looking for alternative answers because traditional medicine is failing you.
Yes.
That's why people start looking in other avenues.
And that's why they're going, what, the
It's alternative.
naturopathic way?
Right.
Yep.
It's an alternative method, right? So understand, insurance doesn't cover what we do.
No.
Okay, that's the hard part, and everybody wants their insurance to cover it. So,
Is it regenerative medicine? Is that part of it?
Anti-aging, regenerative medicine, and recovery medicine. So there's 2 words out there. There's the word habilitation
Okay.
and rehabilitation. We've all heard of rehabilitation before. So that's when, you've been running marathons and you sprain your ankle, and the healthcare professional gets you back up to your marathon potentials. Habilitation is taking somebody that never got there before and building them back to that system. So again, with cerebral palsy, they had an injury when they were younger, so they had this neurological problem. We could reset the neurological problem and get it to be adaptive and help heal it. So it's been taught in the schools, but the practitioners can't pay, the insurances don't see that as the problem. They want to have this. So when I went to school in 1980 for physical therapy, I considered myself a neuroplasticity physical therapist. Our specialties were helping spinal cords, amputees, traumatic brain injuries, and cerebral palsy. Today's doctor of physical therapy 99% of the time is either doing sports medicine and giving exercises.
Okay.
So half the value that they teach today that I learned isn't even in the programs anymore. They put it out to put the sports medicine, the money-making things into the whole process.
And I'm sitting here and I'm listening to this, as I'm sure everybody is right now. You're like, this is old hat for you. You don't look at all surprised. Obviously, you know him personally, and I've known him for years on a professional level. I think it's just downright devastating that this is not discussed more.
Well,
And people
even when
aren't
I
aware
talk
of
about it
this.
with my patients to refer to him, they're all like, well, what is he going to do? Crack my bones? And I'm like, no.
But he's so much, just like you're much more than a dentist, he's
Yeah.
much more than a chiropractor.
Yes, yes. And you have to remember, some of us are willing to look outside the box, right? The box of medicine has been finite for a number of years. And does it work? Not all the time. And most of the time, it's pharmaceutical related. I'm going to give you another drug. We talk about this with the kids with the depression and the anxiety. He and I both see that very similarly, okay? We don't need these medications. We need to get them into a healthier pathway. But how do we do that, right? Because people are so media advertisement, and this is why I'm so upset about the media advertisement. It's like we're pushing drugs on people all the time. And so I come from, I'm going to stay off of that stuff, right? I'm not going to take it. And so when you go to Tom's office, we're both talking supplements to our patients. We're both talking, okay, you have some areas that, like if you're low in iron, I know that it's really important, right?
You're talking about vitamins, supplemental vitamins?
Sure, supplements, vitamins, but it's not just vitamins. It might be magnesium. That's not a vitamin. That's a supplement, right? So when you go to Tom, he and I agreed very early on, we knew a lot of the gut issues that people had affected their face. It affects your health. It affects your breathing. So he and I are very aligned in knowing important food affects your health, right? And how do we transition people from sick to healthy, right? It's a process, and it doesn't happen quickly. It's not an overnight, here, let me give you a pill and you're fixed tomorrow.
Do you have an area of expertise, something that you are maybe a concentration that you spend more time on with patients than maybe some other things?
Through the years, our clinics were here in West Hartford, and in the early 2000s, we had 16 clinics across the world. We were managing about 10,000 cases around the world a year.
But your offices are in West Hartford. Are there other?
There's satellites. We have satellites. We have practitioners. I've trained about 30,000 people.
Okay, but going back to your office in West Hartford, are you the only doctor there, or do you have others that are in that?
I have other practitioners in my office.
Okay.
So,
because there's only so many hours in the day. There's only so many people you can see a day.
It's not one-on-one care with me, but my office, just like Beth's, is we don't just spend 10 minutes with you. It's actually a full hour of therapy. You don't, if you go to a traditional physical therapist or a chiropractor, you see the therapist for 5 minutes, you go over and get a machine for another 5 minutes, and they're actually seeing 12 people in that same hour that they're working with you. Or you go to your physician, you get 7 minutes with them to have the cure.
Oh, you're lucky if you get 7.
Yeah,
Right. So all that, but we take the hour to sit with the person, and we actually do body work. We meld it
I don't believe
to
this.
the person.
I've
So
never
it's
heard of
one-on-one care.
You should experience it.
Yeah.
You
come over and
should
we'll give
go
an
over and
evaluation.
experience
If I
it.
ever needed it, you wouldn't have to convince me. I would be there in a heartbeat.
But you're thinking I need a problem, okay? So we want to, let's say you're pretty healthy, right? We want to maximize so that the aging process isn't as debilitating to you, and you don't know if you have heart and lung and vascular issues.
True, you don't know what you don't know. I get that.
Because you can't see it. Right?
Okay, because I'm running out of time. One of the things that caught my attention, and it's sadly, this is not covered by insurance.
Well, if you have out-of-network insurance, you could possibly submit your own notes. I'm not participating in any insurance programs, but you can take my notes and take it to your insurance company, and if they allow chiropractic out of network, you can get reimbursed for it.
But the work that you do sometimes is out of the scope of a chiropractor, right?
It's body touching.
So it falls under the umbrella of chiropractic.
I am a chiropractic physician in the state of Connecticut, which means everything but giving pharmaceuticals and doing surgery is under my scope of practice. I can deliver babies. I can take blood tests. Those have all been
You just
trained
don't
through my
prescribe and you don't perform surgery.
No, I go to my support team for those things. So I have physicians that are like-minded. I have a couple of advanced cardiologists. I have a couple of advanced MDs that do this work, and they help me take the people off the medication. And as they get better, we start to take all those things down. The big thing that Beth has been with me for about 4 years, and last summer she goes, "Oh my God, I got up and ran across the yard to pick up my puppy."
I haven't run like that in a long time.
And
No, I'm not kidding.
You two are two peas in the same pod. You really are.
Well, coming at it from different aspects, right?
Yeah,
So we're
yeah.
all about.
That's why you're
getting-
a great. I think you're a great tandem.
Well, we've had some interesting cases together.
Yes,
Where
and-
it's taken both of us to get everybody back on a normal track. Okay.
All right, so I got to wrap things up. I've got less than 2 minutes left. I don't know where the heck this time went. How can people reach you, Dr. Thomas Giammatteo?
the phone number is 860-561-2286. My website is imtwellness.life, and we do 15-minute free consultations for anybody that's interested in it.
All right, let me do that again. www.imtwellness.life. His number is 860-561-2286. 860-561-2286.
And if we sparked any clinicians, the school starts September 19th is the first week of the Connecticut School
Coming
of
up, couple months
Integrative
away.
Manual Therapy.
Exactly.
Dr. Thomas Giammatteo, thank you for your time this morning. Good luck. I hope this is not the last time that we see each other, and for good reasons, of course. And of course, let's talk about my co-host here every Saturday morning. I mean,
We always have interesting subjects.
no shortage this week, that's for sure. Dr. Bethaney Brenner, easy to reach as well, online at theburlingtondentist.com, because she's out of Burlington,
And we're
Connecticut.
going to put this on our YouTube channel, so it'll be there.
And I was going to say, when you are on the burlingtondentist.com, please subscribe to our YouTube channel. And call right now, 860-673-7155. First 5 callers, a free sleep assessment for you or someone you love. First 5 callers, here's that number again, 860-673-7155. I want to thank our guest, Dr. Thomas Giammatteo, for Dr. Bethaney Brenner. I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.